So this is part 2 of the review of the journal article that I presented in part 1. Let's hope and pray that my battery lasts. Right, so looking at the conclusion. KZN is historically and currently disadvantaged in terms of funding, infrastructure development and staffing. Mental health services are not a priority. There's a major burden of infectious diseases, trauma and poverty-related health problems on the health services of province. Inequitable funding, inadequate facilities and significant staff shortages are noted in KwaZulu-Natal. There has been limited development and improvement of standards and an increase in accessibility to mental health care services. This has been stagnant. There's been no improvement in these areas. There's been little commitment of KZN government to the Mental Health Care Act of 2002 and the UN Convention on the Rights of Persons with Disabilities and its optional protocol. The recommendations made by the article is for funding a mechanism for hospital-based and community-based mental health service delivery. Decrease of discrimination towards tertiary level psych and subspecialist services, a renewed commitment to equitable distribution of resources, these being infrastructural and human resources to catch up on the national norms, and really to act and not only speak, to implement transformation in mental health care services practically. So when we're looking at this as occupational therapists and other allied healthcare professionals, I was thinking of application. What is a way forward for this? My recommendation is ethics, continually striving to uphold a high standard of service delivery, upholding the principles of autonomy, beneficence, non-maleficence and justice. OTs are to take an advocacy role for reasonable resource allocation. For persons with severe psychiatric conditions, our vulnerable mental health care users and clients, for human rights and holding those who are responsible for financial allocation accountable, to advocate for community-based rehabilitation and the capacitating of human resources and community-based facilities. As stated in the article written by Burns in 2011, we are also to act in the removal of barriers to access social, family-related, accommodation, educational, occupational and recreational opportunities, and to ensure the full participation for persons with mental disabilities. We are to also be proactive. We are to play an active role with district, provincial and other government sectors promoting equitable mental health care services. In terms of legislation, we should know and use existing legislation as we practice, as we motivate for service delivery, for improved service delivery. Let us know legislation. Research. Let us get involved in evidence-based practice that promotes occupational therapy and mental health care. Research is an incredibly powerful tool for us to grow the profession and to also promote service delivery within KwaZulu-Natal. In terms of practice, let us work smart. Let us be strategic in doing what is feasible, cost-effective, but also has the best outcome. In terms of public health, let us participate in public health efforts for health promotion and education, while prioritizing prevention programs. We are really to promote a holistic treatment of mental health care users and uphold the value of inclusion and accessibility to intervention for our mental health care users. And I really want to recommend that we collaborate. I think this is also part of working smart. Collaborate with other disciplines to maximize the potential of community reintegration, relapse prevention, and ensuring quality of life of our mental health care users and their families. And I also believe that it is helpful to think that we are visionaries and we should take on the role of being visionaries. So let us be visionaries and pioneers in terms of mental health care to improve service delivery, and to improve the lives of our clients in KwaZulu-Natal. So in conclusion, do not forget the vulnerability of our mental health care users and the vulnerability of our society. Remember that improved resources will improve service delivery, ensuring health, well-being, quality of life and reintegration of our mental health care users in society. Also remember that resource allocation is not a joke. It is, and that really is not meant to be flippant. Decreased or insufficient resource allocation will decrease the effectiveness and efficiency of service delivery. It is considered negligent and will not prevent the inevitable increase of disease, disability, death, and the burden of disease. And finally, may occupational therapists be part of the transformation of mental health care services in KwaZulu-Natal and South Africa, with the slogan of "There is no health without mental health." I'd like to end with a quote from the TASA statement. The World Health Organization's Rehabilitation 2030 call to action notes that it is negligent to deny people with disabilities the services they need to participate as fully as possible in the lives of their families and communities. I hope that this has been helpful, and please contact me if you have any questions or comments. Thank you so much.